Okay, I go forward. My task is to cover the prevalence of diabetes, which is facing rising challenge in the Middle East. And this is time for action. As I just, want to take you back, as you can see that Dubai 60 years ago, we have, massive changes had took place, as you can see from this picture. And of course, any change and any expansion, it is with a price. And as you are all aware, that diabetes and pre-diabetes is the outcome of our lifestyle. And as you can see from our, rows, it's packed with vehicles, which indicate that we have a sedentary lifestyle, and also our dietary habit had changed, and that had contributed to the rise in the diabetes and pre-diabetes in United Arab Emirates and also in the MENA region, as you're going to see. Now, I would like to share with you the Dubai Household Survey. We do a survey in the Emirates of Dubai every 4 years, and this was conducted in the year 2014 and 2017. And also, we did a new survey in 2019, just before the COVID hit us hard. This household survey, it is in collaboration of Dubai Health Authority and Dubai Statistics Center. It's a cross-sectional multi-stage stratified survey. The houses were visited to obtain a detailed information of different health-related issues. There are almost 5,000 families were screened, and out of those 5,000 families, they were equally distributed between nationals and expat. As you know, we are a multinational country, so we have equal distribution in order to understand our population better. There were a good response rate of 80%, and the final sample was around 13,000, and they were about 7.9% were Emiratis. The design and the methodology of the survey was robust, and it was based on the World Bank Living Standard Measurement Survey and the WHO. So we did publish this in the Dubai Diabetes Journal. It's a journal which is owned by Dubai Health Authority, and I'm privileged to say to be the chief editor for this, and my colleague Dr. Hassanin is one of our associate editor board as well. So what we found out of this prevalence of the diabetes and pre-diabetes among the Dubai population from this household survey in 2014 and 2017, that among UAE national, we have 19% who are diabetic and 18% who are pre-diabetic. And similar to that, among the expat, we have 14% who are diabetic and 15% who are pre-diabetes. So that puts the entire Emirates of Dubai as such, that those who are diabetic in the Emirate of Dubai are 15%, and equal to that, we have 15.8% who are pre-diabetic. So you can see the magnitude of this problem. It's huge. Now, there's another publication we've done from the other survey which we conducted lately in 2019, which is the prevalence of diabetes associated with health risk factor among adults in Dubai. And what we found that the overall prevalence of diabetes in the adult age group 18 and above was 13.7%. Among UAE national, it was 19.3%. And the expat 12.4%. So that means we did not change much from the household survey of 2014-17 till date. There were slight decrease in the prevalence among the non-national, probably because Dubai is a dynamic city, so people move in and out. Now, we did correlate this prevalence of the diabetes to the age. As you are all aware, as we grow older, that the prevalence of diabetes, it increases. And as you can see, for those above the age of 60, the prevalence of diabetes is 43%. But my concern, and of course the concern of all people who work in this field, is those age group between 25 to 44, where younger age group, where we found that the prevalence is high as 8.5%. And as you're going to see later, it's also the same in the pre-diabetes. Now, it takes time. I know that there's some animation problem with this slide. Now, we did also correlate it in this in this survey the weight as well, and we found that those with a normal weight have a prevalence of 7%, those who are overweight 11%, and of course if they are obese the prevalence is even double. So we looked then to the physical activity of those patients, and we found that among Emiratis, if they are physically active, then the prevalence of diabetes is 10%. And if they are physically inactive, this percentage is doubled to 20%. Similar to that is among the expat. If they are physically active, then it's 8%. If they are physically not active, then 10%. So the key here is the physical activity and also the weight, as you have seen. Now, if we move on with this, and we specifically looked into the exercise itself in terms of intensity and frequency. So we found that those who do a moderate intense physical activity, and we define it as 10 minutes spent doing different type of household or even walking at work, out of those only 17% who do daily activity, 18% who do between 1 to 3 days per week, and the majority, 65%, do between 4 to 6 days per week. And just to remind you, it's just 10 minutes that we are requiring from an individual. Now, when we ask those people about the vigorous physical activity, only 5% who said we do a vigorous physical activity, which is defined again as a 10-minute, for example, running or playing a football just for 10 minutes and continuous. So they are not much. So that's another issue that we have in this part of the world. So if we look back to the prevalence of diabetes and pre-diabetes for those who's exercising, is just 8%. If you are exercising, then your prevalence is 8%. If you are not exercising, it even doubled to 20.7%. Now, are we alone in this region? No, we are not. We are not alone. This is also applicable to the rest of the MENA region, as you can see, from our neighborhood country like the Gulf states, and also from rest of the MENA region. For example, Kingdom Saudi Arabia, the prevalence is around 25.4%. You look at Kuwait is 18%, Qatar 16.7%, and if you look at the other part of the world like Jordan, 23%, Pakistan 26%, and Morocco 10.6%. And that's high not only for diabetes as well as for pre-diabetes. We are not surprised to see this because, of course, we are exposed to the same environmental factor, and also we have almost the same culture and eating habit as well. So as already I mentioned, this is the map just to show you that we are from east to west in the MENA region. We have a high prevalence of diabetes across the MENA region. So our government many years ago had published the vision for UAE 2021, which was delivered last year, and the goal was to reduce the non-communicable disease mortality and prevalence of the risk factor by reducing the prevalence of diabetes in adult age 20 to 79 years of age, and also reducing the prevalence of the obesity in children among the age 5 to 17 years of age, and also reduce the prevalence of smoking among adults. And that is collectively to reduce the cardiovascular risk factor and mortality and morbidity. Because of those rising and alarming figures that we have seen in the diabetes and pre-diabetes, we already started a discussion and a dialogue with all our stakeholders in order to put a plan for prevention of our population. So, if I tell you that we can stop diabetes, of course we cannot stop diabetes once it happened, but we can stop the progression of diabetes by preventing diabetes from happening. So we need to identify this group of the pre-diabetic. So with this, I would like to take you to our last household survey, which is conducted in the Emirates of Dubai. It's almost the same methodologies that I mentioned earlier. And I look specifically now to the pre-diabetic. All that, whatever I presented, it is related to the diabetes. So for the pre-diabetes, what we found that among Emiratis, 12% of our Emirati population are pre-diabetic, and it's even higher in our expat, 17%. The overall prevalence is 16.2%. It means that among 1 in 6 individuals in the Emirates of Dubai is having prediabetes. So it's a big number. Now, we also correlated this to the weight. Those who are underweight, they have a low prevalence of prediabetes. Those with a normal weight have also low prevalence of prediabetes. And of course, those who are overweight, they have a high prevalence of diabetes. As you can see, Emiratis 12.6%, expat 25%, and that makes the overall prevalence of diabetes in the Emirates of Dubai 23%. So while in the obese, the prevalence is high, but of course, as you can see, a little bit lower than the overweight, and that's for an obvious reason, because by the time, at that time when they are obese, they already develop diabetes at that stage. Okay, so we also looked in those prediabetes related to their physical activities. And as you can see here, among Emiratis, if they are physically inactive, they have double prevalence of diabetes. Similar to the expat, if they are physically inactive, they will have 2.5 times high prevalence of prediabetes. And then we also looked into the age, the same way that we looked into the diabetic. And you will be now surprised to see that also the prevalence of prediabetes is increasing with age among the Emiratis populations as well as among the expat. And again, our concern here is the age group between 30 to 39, they have a high prevalence of 11.5%. And not only those age, even the teenagers, they have a high prevalence of diabetes in this country. So, and in the line of this, the Emirates Diabetes Society had published a consensus guideline for the management of type 2 diabetes in 2020, which was endorsed by the Ministry of Health and also the Dubai Health Authority. And it was written by 22 key opinion leaders across UAE. And we recommended that the ADA screening should be adopted. That is the American Diabetes Association screening criteria to be adopted. But what we did, we lowered the age of the screening to the age of 30, not to the age of 45, which was recommended by ADA. And the reason we lower the age for the previous slide that I've shown you, because we have a high prevalence of prediabetes in this age group. The other screening is to screen any adult who are overweight or obese with one or more additional risk factor. And also, in terms of follow-up, those people with a normal test result to have their repeat testing once every 3 years, unless the condition is changed, and every 6 months if the person is diagnosed with prediabetes. And also we put some strategy. Of course, we need to identify those individuals. And once we identify them, then we will enroll them in a prevention or a structure prevention program, which include weight management, nutritional therapy, and exercise, and smoking cessation. And when it is required, then we can add the pharmacotherapy for prediabetes if lifestyle fail. So we look to simple tips that we want to tell our patient that they need to lose weight more than or equal to 5% is needed to produce a beneficial effect on their blood pressure, on their sugar control, as well as on their lipid. And also we encourage them to do an exercise more than 150 minutes per week for over more than 3 days per week, with more than 2 consecutive days without exercise. We also advise them for healthy diet and also smoking cessation. So they are very simple tips. If they follow, then we can reach the target. Now you are all aware that Dubai became very active city as well as United Arab Emirates in the past several years. because we had that vision from our leaderships and also from our authorities and Ministry of Health. So Dubai had started initiative called 3030, as well as there are many walkathons which take place across campaigns toward patient campaign and education across the year. And this is a very a good initiative that our country took towards this. But still, there are many things are still needed to be put into place in order to stop the progression of this disease. So with this, I come to my last slide. As you have already seen, that the prevalence of diabetes and pre-diabetes in United Arab Emirates as well as in the MENA region is high, and the prevalence of diabetes and pre-diabetes is strongly related to the age, obesity, and physical inactivity. And I use this form, of the platform to call for action for an urgent structure educational program for prevention in order to stop the progression of this disease. And with this, I would like to thank you all for your attention. Thank you.
Thank you very much. I have one question for you, Doctor. In your mind, what will be the most important factor to be implemented to reduce the prevalence of diabetes? Yes. Take your time. Are you
Sorry
okay?
about this. I have sore throat now. I don't know why. Can we do it later?
Yeah, okay, it's fine. So let's move to the dialogue between Sanofi and Servier. So I'm really pleased to introduce you, Niven Al-Khoury. I just changed the slide, yeah. So Niven, you're General Manager of Sanofi's General Medicine, Saudi Arabia and Gulf countries. And Anthony, I don't know if you can hear us. Anthony is with us remotely. And Anthony Mallet is General Manager of Saudi Arabia and Gulf countries at Servier. I don't know if Anthony can hear us.
Yeah, I can hear you.
Great. Perfect. Good morning. So my first question will be for you, Niven. When it comes to preventing and fighting the battle against diabetes as a public health priority, how important do you think are public-private partnership? And from a Sanofi perspective, how are you demonstrating leadership?
Thank you very much. First of all, I would like to really thank you so much for the great opportunity to represent Sanofi in a very, very valuable forum today. And thank you, Dr. Fathia, for the amazing information as well and the call to action. So when it comes to the public health priority, we strongly believe it should be a community priority, right? It's the governments should not really bear the burden and the weight of all of the public health on their own. And that's where, hence, the private-public collaboration and partnership is very, very important. For us in Sanofi, we totally believe in the collaboration and the impactful partnerships we call, the continuous partnerships that are very, very important to ensure a real true impact on our community. So with our experience in fighting against diabetes for over a century now, we strongly believe of our holistic approach, if you allow me, in providing a comprehensive care. So it's very important, the innovative treatments that are continuously brought to the medical community, but we also believe the importance of the education and the knowledge and the awareness. Dr. Fathia raised a lot on that, but also digitalization digital solutions, as we're going to see. But last but not least, that brings the whole thing is the collaboration and the impactful partnerships. And that's where we can really continuously improve the lives of patients and improve the health outcomes. Among those private-public partnerships, we're very, very proud of so many initiatives, but maybe I'll focus on kids program, where it is brought into the schools because we understand that, you know, as part of the health strategies of any government, it's very important, especially in the region, is really the prevention. So how can we look at and work at the prevention and the education and raising the awareness?
Okay, thank you. And Anthony, so we started this talk with type 1 diabetes in children. Moving to type 2 diabetes in adults, can you enlighten us on Servier's initiatives in this domain?
Yes, thank you, Cecile, for the question. Good morning, everybody. Good morning, Dr. Fatia. Good morning, Niven. As it has been said, as we are speaking, today we have 6.3 million people living with type 2 diabetic within the GCC countries. Public health improvement is the responsibility of everyone, as said by Niven. This is not only the responsibility of the authorities. The pharma industry needs to work hand in hand with the local authorities to win the fight against this type 2 diabetic disease. In Servier, the patients are at the heart of all our activity. We work with the patient and we work for the patient to better co-create innovative and efficient therapeutic solutions. As an example, we have created the program Act Now for Diabetes. It has been launched as a global digital initiative. And I think you already understood that there is no, I would say, big science in this disease. The most important is the prevention, and the priority should be focused on education and awareness.
Thank you, Anthony. And thank you both of you for this introduction. And so, Niven, we've heard about the KIDS program and Sanofi's partnership with the International Diabetes Federation. And can you maybe talk a bit more about the KIDS program frameworks and the KID framework, yes, and how you have successfully implemented it in this part of the world, and how essential is it to have such programs implemented in this region?
Thank you. So the KIDS program, as you said, it's created by the International Diabetes Federation, the IDF, and the ISPAD, so the International Society for Pediatric and Adolescent Diabetes, in collaboration with Sanofi at a global level. And here it's really driven by the fundamental belief and the strong belief of the value of raising the education and the awareness, and the important, I would say, key role that nurses, teachers, and parents play, not only in the prevention of the type 2 diabetes, but also in fostering a safe environment for children who are living with type 1 diabetes. So from that perspective, that's where the KIDS program was born. And here we're very, very proud to say that that program has been rolled out in the UAE 6 years ago, so for over 6 years, in collaboration with the Ministry of Health and Prevention and the Ministry of Education, where I would really, if you allow me, to really recognize and appreciate all of their efforts, endorsement, support, and collaboration, because it comes back again to the partnership and the collaboration to make it a real impactful program, and we still see the impact. So over the last 6 years, we see we have educated over 44,000 students in 94 schools across the UAE, educating more than 3,000 teachers and more than 2,000 parents. So you can see the impact that this continues to bring, distributing and working in collaboration all together on distributing over 60,000 leaflets, booklets, all of the educational, I would say tools that can be very important in schools, but also at the parents' house and their caregivers. So as you can see, it's very, very important. We believe that, the success of kids is because it starts in the school, and that's where it's important. That's where the prevention starts, but also, again, how do we create that important, safe, and healthy environment, raising the education, as you said, on how to become active, have the right lifestyle from a very young age. And therefore, when they are out of the school, hopefully they will be also the educators and therefore the ambassadors for this, and change their habits in that. And that's why kids we're very, very proud of that, and we continue to really be proud of the impact that it is really generating generation after generation.
Thank you very much. So thanks to Niven, we now know about Sanofi's Kids program. So Anthony, can you please tell us more on Servier's Act Now for Diabetes initiative and its local implementation?
Yeah, of course. So Act Now for Diabetes is a global initiative developed with and for the type 2 diabetic patient, as I said before. It is a social media campaign where the objective is to raise public awareness and prevention about type 2 diabetic. The campaign has been launched in collaboration with the Ministry of Health and Prevention. Macum social media public platform has been coupled with the Servier GCC Facebook page. This Act Now for Diabetes focus on educating the public about three, I would say, main action or topic. Leading a healthy lifestyle, as it has been said before, so meaning diet and regular physical activity. Encouraging the public to check their blood glucose level on a regular basis, and on the importance of early detection in the prevention of type 2 diabetes and its complications.
Thank you, Anthony. Niven, I have another question for you. In an ever-changing healthcare dynamic, how is Sanofi coping up with this ongoing digitization of healthcare services, especially in the area of chronic disease, such as diabetes, which has been around for quite some time?
Well, first, it's important to highlight the importance of how do we continuously engage very closely with our customers and patients to really understand the real evolution of the needs and gaps. So as you said in the question here, today's world where we're living even more and more the digitization, right, throughout what we live in throughout the pandemic, we learn a lot, and we also see lots of changes in our customers' needs and patients' needs, where the acceptance and how the way they embrace digital solution is becoming way much higher than before the pandemic. And not only higher, but it's becoming part of the urgency and part of their needs, day-to-day needs, right? So hence we started co-creating, as we were talking about, the co-creation, and the idea came with the digital patient education program, which we will launch. We're working on it and we're launching it soon. And the idea here is very important in the palm of the patient's hands through a simple application. How do we can have a designed and personalized content to help and support that patient into reaching the lifestyle that is really tailored by that patient in particular. And of course, it's always in line and aligned with the physician's recommendation. So what does it do? It's a real comprehensive tool application that connects first better between the patient and her or his physician. So it's a better communication tool, I would say, connecting them always together, but also have that comprehensive, I would say, care coach online that is always available to support the patient as needed. So we're very, very proud. We see it as it is the first of its kind that will come into the market, and we believe that it's going to really help and support patients, but also physicians on their day-to-day management of these conditions, so that, bringing better health outcomes again to the patients and their caregivers as well. So in the palm of their hand through a simple application.
Thank you, Niven. And Anthony, as you mentioned, patients are at the heart of all Servier's activities. You've shared with us the Act Now for Diabetes Patient Education Initiative in Type 2 Diabetes. What can you tell us more about Servier's digital solution and patient education in the new era of digitalization? We can't hear you, Anthony.
Yeah, this is my usual mistake. I forgot to.
Okay, it's perfect. It's perfect.
Sorry about that. So what I was saying is, first of all, I do echo what has been said about the evolution of digitalization in the healthcare services. The whole medical community now use digitalization. By medical community, I mean the healthcare professional, but also the patients. Today, digital transformation is a norm in Servier. This digitalization has opened new doors for exciting opportunity and new dimension in order to educate the patient and in order to increase the awareness. Digital education platform will be soon available, and we are working on mainly My Health Partner, a website which is dedicated to the education of the type 2 diabetic patient, and very much adapted to the GCC and local situation. The primary focus is to help the patient having a healthy life and living better with their disease, type 2 diabetic disease. The second digital tools we are focusing on is an app, Diabetes World, and this app is supposed to be the daily companion of the type 2 diabetic patient. In this app, the patient will be supported in his daily life, in his prevention action, in his daily diet, in his physical activity, in the monitoring of his symptoms, complications, and much more than this. So these are the two digitalization tools we are focusing on in Servier.
Okay, thank you, Anthony. And Niven, I have a last question for you. In line with the above, what is Sanofi doing to develop solutions and services for the patients beyond the pill? How does the future look like?
Thank you. So again, with over a century in fighting against diabetes, we strongly believe in continuing to provide the continuum of care through different solutions. And again, it's important to highlight digitalization is because to simplify the way and to really respond to the unmet needs. So it's important to continuously understand the evolution of those unmet needs and those gaps so that we provide the right solution and therefore connect, as we say, physicians, healthcare systems, and patients, but even with the caregivers, as we've seen in different examples. So globally, there are so many digital solutions. Let's put it this way. But what we believe is, and we work very, very closely with the different partners and various partners across the world in bringing the important solutions to the patients and to the healthcare system. So I'll just list as an example among them. We're talking about the continuous glucose monitoring system for glucose monitoring effectiveness. We talk about the smart caps for the insulin delivery and insulin dosage. We bring also the MyDose Coach titration application. Also, we look at beyond the clinical research trials and the clinical trials, the real-world evidence. So how can we bring also the digitization in speeding, bringing those valuable data? So if I give an example and I zoom on a couple of them, and I will start by the MyDose Coach application. It's a titration application. It has been launched in Saudi Arabia and Kuwait, and it's ongoing for UAE. It's the first of its kind, FDA approved, EMA approved, which helps really the patient in a very simple way and the physician so that it suggests an optimized basal insulin dosage that helps the patient to reach to the optimal dose without going higher than needed or lower dose, taking lower doses, in a very simplistic way of saying it. So really brings lots of empowerment to the patient and safety as well, to ensure that they are starting on the right dosage. Looking at the real-world evidence also, we believe that, of course, the continuous clinical research and trials is very important. But beyond that, digitalization as well has helped us to bring a real-world evidence in a very fast way, which means assessing in real-life setup important data that brings important value inputs that helps us as a company, as Sanofi, in partnership with the health authorities, with physicians, medical communities, to tailor and design the needed programs, the needed education, and therefore evolve based on the outcomes, the real collaboration needs. So it comes back again to better insights to drive the better collaboration or impactful collaboration.
Thank you, Niven. And Anthony, I have also a last question for you. We've seen the challenging of patients with type 2 diabetes in terms of high prevalence and low control rates. We have also seen how education, increasing awareness, and digital solution can help. What other challenges do patients with type 2 diabetes face, and what can be improved?
Definitely, I would say compliance and adherence to the therapy. These are the major challenges faced by the patient in the type 2 diabetic disease, and in any chronic disease, I would say. The compliance and adherence has a great impact on control rate and the quality of life for the patient. Improving adherence go beyond the pill itself, especially in the framework of digital solution. There is a lot of options which can be used to help the patient to better comply with its treatment. In this, I would say, logic, we are developing the 2022 Ramadan Campaign, a campaign which will be here to help the doctor to communicate with their patient, to sensibilize them, and to help them to properly comply with their treatment. This campaign will help them to advise on tips how to fast during the month, how to safely fast during the month of Ramadan when you are a diabetic 2 patient, while maintaining your glucose control. And this type of campaign is really supposed to be a very high level of communication tool for the doctor in order to sensibilize the patient. And as I say, not only about the disease, because here we are speaking about patients who are already diagnosed, but about the importance of complying with the treatment. Second thing we are also focusing in order to improve this adherence or compliance with the treatment is to provide the real-world evidence studies which will help the doctor to have better data, better understanding about the patient, and better understanding how to improve the quality of life of the patient. So the more and better we understand the patient, their need and their expectation, the better the medical community can fight with this chronic disease.
Thank you, Anthony, and thank you both of you. So now we can move to the Q&A session. I don't know if we have questions from the chat. Yes? So...
Yes, we do.
Thank you.
Just 1 second. I will put my camera on. So we have several questions from the chat room. Hello, everyone. So it's for Dr. Fathia. And the first question is, how was the pre-diabetes status defined in her survey? Was it clinical, biological, etc.?
Sorry, can you repeat that? How was the pre-diabetes?
So how was the pre-diabetes status defined in your survey?
Yeah, this is based on the AD criteria of the of A1C. So we took the AD criteria for that.
Okay, thank you.
Which is 5.5, the A1C. Okay?
Okay, great, thank you. And the other question is about type 1 diabetes. Do you see any difference in terms of prevalence and incidence of type 1 diabetes in the United Arab Emirates compared to the rest of the world?
I can say yes, but we did not look into this in our household survey. But this is a real good question, which also had explored this discussion when we looked at our data. And I think in the future, we need also to look into this. But I can say yes, this is from the admission that we see in the hospital for those newly diagnosed or those who come in acute status like diabetic ketoacidosis.
Okay, great, thank you. And there is
Thanks.
one last question for you. Is there any link between the insurance coverage and the progression of prediabetes in the United Arab Emirates?
I think insurance is a huge problem all over the world, so UAE will not be different than the rest of the globe. Especially the insurance system had been established in the past few years here. We still need to understand it, learn it, digest this, but yes, it is a hiccup as well, yeah.
Okay.
I hope we will overcome this over the years.
From the chat, these are the only questions. If the audience has any more questions, do not hesitate to ask them in the chat room. Thank you.
Thank you. Are there questions in the audience here physically with us or no? No? Okay. Yes?
Thank you for all those figures you are talking about prevention, and that's a key. That's clear. It's a key, but in particular to identify with that risk of diabetes or pre-diabetes. But I was wondering, I was questioning to which extent it is reversible. I mean, is it a short-term stake or not? If I'm a man of 40 years, overweighted, and with no physical activity, and then I change my lifestyle, will it take 1 year, 2 years, 10 years to change my risk of having diabetes? It means it could be a short-term issue or a long-term issue for a country. You are talking about education, which is long-term, that's sure. But I was wondering about the short-term impact of changing the lifestyle.
I think, can I just take, yeah. I think it's important, that's a good question, because we need the sustainability of this. It is, first of all, it is reversible. If we follow that lifestyle, it is reversible. But of course, we need sustainability for this. That's why what we look at, I know that there's a fantastic, effort is done by all our, stakeholders, including the industry, toward this. But what we really need is, a structured educational a program which can be as a prescription, the way we prescribe the medication to our patient, it should be as a prescription. And not only this, I just want to also second what my colleague had said, that it should be smart, because we live in the smart era now, because of course, with this percentage of a high prevalence of, pre-diabetes, you cannot educate the whole population face to face. It's impossible, especially in a busy clinics and also hospital with busy physician, with limited number of, educators. It's impossible. So I think the smart application will be good, but we need to think of, a robust smart application that can be adopted with supervision of, for example, of coaches for the patients and a continuous follow-up. Okay.
Thank you very much. And Anthony, even if you want to react or to ask questions to each other, you can. Just tell me. Dr. Fateh, I just want to ask you my question.
Sure.
So in your mind, what will be the most important factor to be implemented to reduce the prevalence of diabetes?
I can say the physical activity, as I already shown you, because I think, to change people of eating habit It is not possible because, especially in our nation, in this part of the world, we love food, and we like to indulge in parties and all. And we have now many also, cafes, restaurants. And the first thing that even when we travel, the first thing we'll ask, please send me the list of the best cafe and best, restaurant in that country. So I think to change people eating habit is impossible. So I think the only thing that if we work on is the physical activity. I think that's win-win situation. But of course, we will be requiring, many places to do this because now we do have, for example, in UAE, many places which, provide this. But as you know, that when you go to gym or clubs, it's expensive and it's not affordable for many people. Sometimes, it's quite high. So if we provide them with other tools, as I mentioned, like the smart application, then that will be another easy. With, even if you're going to charge them, let us say, even if you put this on the bill of the insurance and you charge them for a minimum fee, I think that will be more efficient.
Okay, thank you. And you're talking a lot about the importance of lifestyle, but I'm wondering, are there genetic reasons to explain why diabetes in this region is so high, or is it just lifestyle factor?
I think our genetic did not change over the past 60 years. We are having the same gene. But I think it's our environmental factor which had changed. So if anything we have to do, we have to play around our environmental factor.
Okay, thank you. It's very clear. Okay, do we have question? No, okay. So thank you very, very much. It was really interesting, and we were very honored to have the three of you here today. And so now we can move to the pitch session. So first, to make the link, with the previous session, I would like to introduce you Eric Dessertaines, CEO of Biocorp, because Biocorp, if I'm not wrong, has signed 2 years ago a contract with Sanofi for its digital innovation. So Eric, can you hear us?
Yes, perfectly. I hear you.
Okay, so I leave you the floor.
Good. Thank you very much, Aziz. Thank you, everyone. Very happy to be with you this morning, even if it's virtually. I'm the CEO at Biocorp. So we are a French company active in the field of digital health and medical devices. And for the last couple of years, we've been working a lot on diabetes and providing a solution for patients that are treated by insulin and more precisely by pen injection. So this morning I'm here to talk about Biocorp, but I'm also here to share a story, and that's the story of Sofia. So Sofia is not my wife, she's not my sister, she's still a friend. We know each other for a pretty long time. She's working as a software engineer in a biomedical company, and she's very athletic. We've been running a marathon in Paris in 2014. But Sofia is not exactly as the same as I am, because I'm not diabetic. She's diabetic. She's type 1 diabetic. She's been diagnosed at 8 years old, and she's living with that disease since then. So as you know, diabetes is, I would say, is a pretty complex disease, as we have to monitor the blood glucose level of the patient a couple of times per day and making decisions a couple of times per day, which is, I believe, something completely unique in that way. I don't have any other disease in mind where there's so much complexity in managing your treatments upon different type of criteria, so physical activity, stress, etc. So Sofia is living pretty well his life, but sometimes, like any other patient on that planet who is managing diabetes and insulin, she's forgetting about her treatment. She's sometimes worried or anxious about making another shot of insulin because she forgot what she did 5 minutes ago. So that's big issue, and that's big, I would say, complexity is related to adherence. Adherence is is approximately impacting 50% of chronic patients over the world, and it's also impacting diabetic patients. So at Biocorp, we try to develop some tools to help patients, and more precisely here, insulin-trained patients to better live their life. So it's really in that context of providing serenity, of providing simplicity, that we have developed our solution. So our solution, and I will give you more details later on, is that a small sensor that attached to existing pen injector. So the pen injector is being used by approximately 60 million patients on that planet on a daily basis to administer basal insulin or rapid-acting insulin. So we are together with some partners, blood glucose monitoring companies such as Roche, or insulin companies such as Sanofi, as we mentioned before. We are partnering together and provide what we believe will be a comprehensive solution for the patient ultimately. Our goal is to help the patient better manage his disease, improve his clinical factor and evidence, so working on the A1C of the patient, and provide him a life like any other person on that planet. That's really the ambition of Biocorp. So in a nutshell, our product, Malia. So it's a simple way on purpose. As you understood, the life of diabetic patient is already pretty complicated, so we want to
Thank you very much, Eric. We will keep the question after the three pitches. Thank you.
Sounds good. Thank you very much.
So now let me introduce you, Frederic Dion, CEO of ExactCure, and you will present your digital twin technology allowing better management of medication intake. I leave you the floor.
Okay, do you have the controls of the slide?
You can... Yeah, just
yeah, thank you.
2 seconds.
Well, before the slides, first of all, it's a real pleasure to be here with you today at this fantastic expo. It's a pleasure also to talk about my company, the company I created 4 years ago, ExactCure. Well, you will see it in a few seconds, I hope. Yeah, that's technology, but we'll talk about technology too. It's a bit different from diabetes. You will see that. Well, diabetes is one of our fields of interest, but not the only ones. Well, we are applying artificial intelligence and modeling, what we call digital twin, to the drug modeling, and in particular drugs in diabetes, but not only. I think I have the control.
I think it's okay. Yeah.
Yes, it is. So we're going to see how artificial intelligence could help to personalize medications in general and to properly use drugs. We are a medical device, we are a digital medical device. But first of all, the starting point is maybe why? Why ExactCure? You know, it's a startup, so why are we so motivated every day when we wake up at ExactCure? Well, it's because we think that drugs are maybe one of the best inventions in the world. That's true. It's almost magic if you think about that. You're sick, you take a pill, and you're not sick anymore. But we also think that it should only do good to people, and as you know, it's not the case, not all the time. There are more people dying because of inappropriate medications in the world than in road accidents. 5 times more. For you and for me, it's not acceptable. So we have to fight against that. And of course, it costs a lot to insurance companies, to pharma companies, when you know the cost of a drug. So how to avoid those underdoses, overdoses, or drug-drug interactions? Well, why is it so complicated? Actually, it's because we all react to drugs in a different way. That's the principle of personalized medicine. So what we propose is what we call our digital twin. This is a digital medical device that is integrating your own characteristics, your age, your weight, your height, your pathologies, etc. And then what you see here is the patient version. We have a patient and the healthcare professional version. This is the patient version of the medical device. This is a very simple dial, a clock, and when this patient takes a pill, this is an example of a painkiller, a new ibuprofen, for example. If he takes an ibuprofen at 6 p.m., we say, okay, it's not active just right now. Wait, it will be active in 20 minutes until tonight at 11 p.m. approximately. And you see this green strip around the dial. This is a reflect of the drug intensity as a function of time at 6, 7, 8, 9 p.m. And if you see it closely, you see it's not homogeneous. The intensity of the green is dependent of the intensity of the drug. This is PK/PD for the one who are doing for my pharmacology. Well, I'm a former pharmacology teacher, that's why. But that's a good scenario. But let's imagine that now that there is a problem. This guy is taking too much of this drug. 400 milligrams is too much because, for example, this guy has a kidney or liver issue. Then we simulate that as a function of time. You will see between 7 p.m. and 9 p.m. that the intensity is red. It's too much. This guy will be overdosed, overexposed to the drug. So this is the core service that we provide. We are unique. We are the only ones to provide this type of on-demand service, on-demand simulation, personalized simulation of a drug. And on top of that, we provide also a pill reminder for compliance, for example, and a lot of other things like real-world evidence collection, how patients take drugs, how do they feel when they take their drugs. I can make you a demo if you want later. It was the patient version. This is the healthcare professional version. I took an example in the field of diabetes, one of the most famous drugs, metformin. And you see for this woman, because she's 55, she has a strong renal impairment, then this classical drug regimen is too much for her. This is a bit more detailed for healthcare professionals. This is not a dial, this is a curve, the pharmacological curve as a function of time. You see, in green and red, this is the therapeutic window. This drug goes above the overexposure threshold every day for this woman. So this drug regimen is not appropriate. So if you adjust the drug regimen, for example, 500 milligrams for this woman 3 times a day, you see that then she stays in the therapeutic window. Okay, as a conclusion, I would say that we bring 3 innovations to the world. First of all, this is a disruptive usage because, well, now when we take a drug, we're kind of blind, in fact. It's like driving a car without any dashboard, without any speedometer. We provide a drugometer, if you want. So, second, this is in the scientific approach, how we provide our simulations. This is what we call meta-modeling. Our artificial intelligence is screening the literature, the clinical and scientific literature, and is analyzing all the influencers of a given drug, weight, age, height, and so on. And then we integrate all those factors in what we call a meta-model of the patient, and this is what we provide in the application. We'd be glad to enter into details, trust me. And third, we also integrate the patient feedback to improve our understanding of the drug and to collect real-world evidence and to improve the models. Okay, we won many prizes, awards, we were invited by the MIT and so on. Well, okay, good. I would say that we are ambitious, yes. We want to become a worldwide reference in personalized medication simulations, and we are very proud of what we do. We want to collaborate with hospitals, with pharmaceutical companies, because we believe that in a couple of years, exact cure will be obvious, and that we won't be blind anymore when we take our drugs. So this great, fantastic invention of mankind. So thank you.
Thank you very much, Frederic. And now we are moving to Arnaud Lambert pitch. Arnaud Lambert is CEO of AI Screening, and he will present his AI diagnostic aid algorithm, and in particular its application in the screening of diabetic retinopathy. Arnaud, can you hear us?
Absolutely. Thank you, everyone, for having us this morning. Hopefully, it's way hotter in Dubai than it is in Paris, with a little over 0 degrees here. Let me get into the presentation this morning. I really am very much like the intervention of Dr. Fathia, Niven, and Anthony, and it echoes pretty much the work we've tried to do over the past years with AI screenings. So what we do, we are a company that was founded 4 years ago. We are a med tech company. We are ISO 13485 certified by the BSI, and we basically do artificial intelligence medical devices, and we work in the field of ophthalmology and dermatology. The first medical device that we developed is for diabetic retinopathy screening, and the reason why we did it is actually to echo what has been said this morning. 1 out of 3 diabetic patients will have diabetic retinopathy. So it's not so much a question of if the diabetic patient will have the pathology, it's more about when will the patient have it. And when we actually focus on type 1 diabetic patients, the literature shows that 90% of those patients will develop at time diabetic retinopathy. So really the challenge for us is to provide a simple tool to enable diabetic retinopathy screening, since the literature and the ADA recommendation requires an annual retinal screening. Unfortunately, there is not any more patient specialists to do those screenings, and in some areas in France and Europe and other areas of the world, you can wait over 6 months, and sometimes you don't even have a special.
And with this, I'd like to end our presentation with the international recognition by Microsoft from John Doyle, who's CTO of Microsoft Health and Life Science, because we believe that artificial intelligence medical devices should be robust, but also make sure that the data that is used upon to provide diagnosis is confidential. And we are currently working with the UCSF, which is the University of California in San Francisco, to provide that service in diabetic retinopathy. And to actually give some context, we are currently working with other countries in the region, and we are looking forward within this Dubai exposition to actually move forward and deploy our solution across the GCC region. What we have found, and this is my last take for the call for action for the ones who are in the room, we have found in certain underserved areas that we are covering that the ophthalmology team is currently below the number of the required numbers to grade the diabetic retinopathy screening in some areas of Africa. And we would like to call this action for a team of ophthalmologists or vision specialists to provide remote gradings. So if you feel up to giving some time to the community, do please come and visit us. Thank you very much for everyone and your attention.
Thank you, Arnaud. Do we have question for Eric, Frederic, or Arnaud? And maybe from the chat? No? Okay.
From the chat, there is still one question for Dr. Fathia, if she can still answer it. She seems to be the popular one today. So one last question for Dr. Fathia.
Yes, please.
From your point of view, what could be the criteria of reimbursement for advanced technology in patients living with diabetes?
Difficult question.
Yes.
Very difficult question. I don't have answer for it right now.
Okay.
Yeah.
Okay.
Well, anyway, the questions were quite interesting, so thank you for asking them. And so far, we don't have any more questions from the chat, if someone else has.
Okay, I have question for Eric, Frederic, and Arnaud. So we will see if after that we will have a question from the chat. First, Eric, I don't know if you can hear us again.
Yes, I'm hearing you.
Yeah, so thank you for your presentation. I have a few questions for you. First, in which way Malia is changing the life of diabetic patients?
It's a good question. So as you understood, diabetes management is pretty complicated. Insulin management is very complicated. So insulin is something that happens for all type 1 diabetic patient and for certain type 2 diabetic patient. And providing the information about insulin intake is something which is very important for two reasons. One is really improving what we mentioned before is working on serenity and lifestyle of the patient, so making sure he's not anxious, is not worried about forgetting his shot of insulin or making 2 shots of insulin, etc., which is a pretty, a very efficient drug, but also could be potentially dangerous. And the second one is integrating that information into a global digital solution that is not only about insulin intake, but has other information that related to blood glucose information, physical activities, and I think that's one of the future of diabetes management. So providing all this digital solution in a comprehensive way. I can say that it's a challenge because the industry as a whole needs to partner to initiate those solutions and then commercialize those solutions. but we hope to bring our let's say our expertise in the medical device area to help patients ultimately.
Okay, thank you. And are you the first one on the market with this kind of technology?
Yes, we are the first one. It's a project we've been kicking off approximately 6 years ago. So it could be considered as a long time ago. In reality, in the medical device industry, it's not so old. And yes, we've been investing in that technology. It's really designed at Biocorp. We are manufacturing that device as well in France. And this product has been distributed already in a couple of countries. So for us, the challenge is continuing to expand in additional geographies, and at the same time continuing to improve that product and the patient experience. So that's one of our major commitments at Biocorp.
Okay, thank you. And my last question, can that insulin intake information be connected with the blood glucose level of the patient?
Yes, definitely. That's the ultimate goal. So we won't help the patient alone. As I mentioned before, it's really a team that we need to build around that insulin dose intake information. So I think there's definitely a lot of parties around, and I've been mentioning already our partners in that area. So insulin companies and blood glucose companies that are very, very important partners and players for us to provide ultimately the best solution to patients.
Okay, thank you. Thank you very much, Eric. And
there is one last question from the chat room.
Yes, okay.
So where is your smart cup available?
So it's changing depending the countries. So we've been launching in Taiwan, for instance, and it's been available in hospital and clinics. So it's under prescription from physician, and it's been delivered at hospital care. In France, in another countries where we've been launching, we are promoted in pharmacies by Roche Diabetes Care. So it's direct access to pharmacies. So I think that's a very good question in the sense that there's a model to be built around distribution of that product and new services. So I think there's no one model fits all for all different countries. But that's a couple of examples of where you can find Amalia and potentially in other countries, either us or our partners could set up some digital way of getting the device, such as websites and smartphone applications. So it's pretty open in that regard.
Okay, we have a problem with the screen, but it don't mind. We don't have slide anymore. Okay, great. You're back.
Okay.
Do we have? Thank you very much, Eric. Do we have other questions from the chat? Not for now?
No, so far no.
So I have some questions for you, Frederic. What level of precision can you achieve with your modeling approach compared to what is done in research laboratories?
When we are presenting what we do in scientific congresses, we are benchmarking what is existing in terms of modeling, of pharmacological modeling. And what's interesting is that we don't need new patients to build a model. We are using the existing publications and the existing clinical trials, and we are combining them. So when we compare individual trials and the models that the results of those individual trials compared to the integration of 4 or 5 different trials thanks to artificial intelligence, we prove that we are systematically better in terms of precision of the modeling and the simulation itself.
Okay, thank you. And do you simulate all the drugs, and how do you choose which drugs to simulate?
Yes, we don't simulate all the drugs now. Our ambition is to simulate 10,000 drugs, which is quite exhaustive of the molecules in let's say in the classical country. But we are covering 3,000 drugs right now, and those drugs depend on the therapeutic domains. We have different therapeutic domains of interest, like painkillers, anti-inflammatory drugs, chronic disease in general, oncology, cardiology. But in fact, it depends on the partnerships we are making. For example, we are launching an app this month with a laboratory in France dedicated to the drugs of the family, I would say. Not the chronic disease, but the acute drugs that you buy at your pharmacy store, for example. And so we develop drug models for them. So it depends on the partnerships we are signing.
Okay, thank you. And last question, is your solution a paid solution? Who are your current customer?
For the moment, it's free for patients and free for healthcare professionals. And our business model is to deal with private companies, insurance companies, and pharmaceutical companies. In fact, if you have one drug of interest, you want to integrate in a model that we deal together, and we can sell either an application itself or the access to simulations. For example, with this lab I was mentioning before, what they are buying to us is just the simulation, the core simulation, and they integrate it in an independent application.
Okay, thank you. So okay, there is a question here. I don't know if we can have Mike, yes. I think it's coming. Someone is coming, it's okay. Thank you, sorry.
Thank you. So just Frederic, really a nice presentation, and pharmacology is actually one of my really big interests since college. So I'm wondering, like, how do you? So you showed like one pill that is being there on the application for the patient. How do you combine like different pills? Are they like combined? If I mean usually. And if you consider, like, older patients, they're usually having their therapy like up to 10 different medications. Yeah. How do you combine those?
Yes, of course. When you take different drugs, of course, you have, for the patient, you have different dials, one for each drug, in fact. So you switch from one drug to another one. And to give an example, we are collaborating with a US company right now on drug-drug interactions. And what we are working on for them is typically a case of 15 drugs in one prescription, and to integrate the quantitative influence of drug-drug interactions. So not only to switch from one drug to another one, but also to integrate the impact of drug A on drug B on this simulation.
Yeah, definitely. I mean, from that perspective, does the patient, how is that delivered to the patient? Because usually they don't have the education, right? The ones that we have, maybe from the scientific perspective. So what actually does, I mean, just wanted to figure out like how patients does perceive that.
Well, I like
if they have like different, comorbidities, yes. Different like kind of.
Yes, I like to say that it's not simple to do something simple, clearly. And the technology that we develop is not simple, but we want to make it simple when you use the app, and this is what we tested with many patients. And I will show you the application if you want. You will see it is actually very simple. You don't have the feeling that you have technology beyond what you see, but. We tested with patients, and for example, we saw that it works. After 3 months, for example, more than 2/3, 66% of the patients are still using the app after 3 months, which is not bad, at least once a week. So it means that they understand the thing, and there is a kind of adherence to the application. Compared to classical application without simulation, we collect their feedback, how they feel. But not only we provide information, we say your drug is efficient or not efficient or overdosed. So I think this is an incentive for them to use the app and to make kind of effort to understand how to enter their data, which is not simple, in fact. But they make the effort because the reward is that this digital twin is the reflect of the drug they take every day. So I think there is a kind of anxiety about how the drug works, and we show them. So that's, I think, a motivation to go beyond the relative complexity of using an application like that.
Okay, so the last question, thank you for that, is for HCPs, for instance, like how do you connect different specialties? So if I'm an endocrinologist, I want to prescribe metformin, right? But at the same time, maybe this patient is also using some other medications that are not good for his current, like, therapy maybe that will be prescribed. So how do you connect the different specialties between it?
Well, first of all, there is just one account that is put in mirror between the patient and all the healthcare professionals, the physicians, but also the pharmacists. So different specialists, for example, they can share the same patient, and then they see which specialist prescribed which drug in the history of the patient from the healthcare professional perspective. But of course, the ideal context is that every specialist uses the app. If one specialist is not connected at all, they are using papers to write prescriptions, of course, we will not be able to collect the prescription. But the ideal context, and in many countries it is the case, is a digitization of the prescription, of course. And then we are collecting the prescription, and we can share it. And that's true that this is exactly the example of the 15 lines in one prescription we are studying, because there is a cardiologist, a GP, a specialist in endocrinology, for example, and they all prescribe different drugs that are independently studied, and all the clinical trials are good for these individual drugs, but when you combine them, then of course there is a stake of compatibility and drug interaction. So yes, they share the same patient file, and we integrate DDI, drug interactions.
Thank you. Yes, we have another question.
Thank you very much, Frederic. In my last hospital in UK, we did a randomized control trial on hypertension patients, giving them education and blood pressure monitoring. The key for the education was for them to understand their therapy. What is this drug? What does it do? How does it function? What are the side effects, so that they can understand it and they adhere better to therapy. And the outcome for the study was those who received the education got better blood pressure control with less pills. How can your application change the patient to be the owner of the information and to be better educated, so that if I were to go into a Dubai doctor in the private sector out of DHA with a different application, I still have the information, and I can then, I am the patient, I'm the owner of the information, and I will understand better the different drugs and why I've been taking them and the interaction for other things. So your discussion about disease therapy, so hypertension or diabetes, something like this, how can the application help with better adherence and better education?
Yes, that's very interesting. I totally 100%, 200%, if it's possible, agree with what you say. I think that understanding is the key for patient compliance and empowerment for their drugs. We believe that we are contributing to that because we are giving something unique. This, what we call this drugometer, is a clear message. It seems like magic, like what I was saying. You take a pill and you're supposed to be cured. But it's not magic, this is science. And we show you this science in a very simple way. And the very simple notification that we send to the patient saying, not only take your pill in 10 minutes, but saying, now your drug, your metformin, for example, has reached the efficacy level in your blood. This is, I think, a message making them understand that they're not taking something magic, they're taking something that you can monitor directly in their blood. I hope it contributes to education, and I totally agree with you. I hope so, clearly. This is what we see with patients.
Thank you. We're running late, but I would like to ask two questions to Arnaud. Arnaud, can you hear me?
Absolutely, Celine.
Thank you. So my first question is, how long does it take to implement a solution like yours?
So in our experience, it takes a couple of months to demonstrate the efficacy of our software as a solution. Basically, the whole solution is hosted within the country. And for instance, if we take example of Dubai, there is a data center where we could actually host the system and deliver the service. For instance, at the Dubai hospital, within a couple of months, implementing in production. So it's really fast and easy for the hospitals or the governments to implement our solution.
Thank you. And where is the medical data hosted, actually?
Well, from a hosting perspective, we recognize it's very important that the data doesn't leave the region or the country, depending on the regulation. So what we require is to have data hosting service within the country or the region that is compliant with the local regulation. We are currently in the European region GDPR compliant, and in the US compliant with the US regulation. And we understand that in Dubai there is also data centers, namely Azure Data Center, where we can provide our services from.
Okay, thank you very much. So I had to conclude. So thank you very much, all of you, for your very interesting intervention, and have a good day.